Anna is a founder of a Dizzy Health Academy, and she's a co-founder of Masters in Global Health program. And she is also a scientific staff member for a decade. And she's also a president of One World Medical Network. That's a non-profit organization. And that's really excellent, Anna. That's really great you are here. So Anna is a multilingual and she's fluent in German and English, and she's professionally proficient in French. That's really excellent on her part. And now I take this opportunity to welcome Anna onto the days, and she's going to start with a speech. That's great, and you can start with your speech, Anna. The stage is all yours now. Thank you so much.
Thank you very much. Will you share my slides?
Yes, sure, yes.
Okay. I would like to introduce myself again a little bit in a additional way, different way. Of course, everything was right, what you said. First of all, I would like to thank you that I can be here at this interesting conference about public health and nursing. Now, as you already mentioned, I'm the president of One World Medical Network. There, I get all my practical experience. And because in One World Medical Network, we are doing projects. My colleagues and me, we do projects all over the world, mainly in low and middle income countries. And it's always about health, and it's always about digital health. And I'm also the CEO of Schmaus-Klughammer, the company, where we also develop software. We develop software which is then also used in projects. So we get a feedback from the practical side to the theoretical side, and we can implement in the theoretical side what is needed in the communities. And as you also mentioned already, I'm also the founder of Klughammer Academy, because as we found out or realized in our practical experiences in the project, it's so important also to train people. It doesn't help a lot, to provide with software, with hardware, and then say, here you have telemedicine, you have digital health. Why don't you use it? We found out it's so important to train people about different topics, not only about digital health. We train people about what is public health. Yeah, what is it? That is so important. And therefore, now, what is public health? It is not only the practice, but it is also the science of healthcare and how to prevent diseases. That is what I taught at the university, because I taught digital health and public health to students, to international students from all over the world, because as you said, I am in Germany, and in Germany we teach normally in German language at university. But I was at a special university where there was one complete faculty where we only taught in English, and we accepted students from all over the world. So 99% of all our students were from abroad, and most of them were from, let's say, from Asia, from Africa, and they came to study. And here I also gained a lot of insight about what people know about digital health, what they know about public health. And therefore, I know that there is a lot to do. And therefore, I appreciate very much also that there is this conference where we can talk about it. So now, public health, we already know. Now, the question is, how can we combine public health, nursing, and digital health, do they belong together? Is there something which is important, why we need all three of them? And that means, yes, public health is, it focuses on the health of the population, and nursing focuses on the health of individuals and families in the communities. And digital health, it provides tools which allows nurses to improve healthcare and to improve public health. So all these belong together. Now, nurses are at the front of healthcare. They talk to, or they have contact to the families. And now it's so important that they have a good understanding and a good connection, not only to the patients, but how can nurses get connected to specialists, to doctors, when they are in areas where there is no doctor. And in many low and middle income countries, we have this problem. We see that problem. And I also want to mention one other important topic, which is universal healthcare coverage. And it means that all individuals and all families will be covered by a good health care, so that the health in a country becomes really good for everybody, and not only for those who can pay and pay out of pocket. Okay, now please go to the first, to the next slide. I show you two pictures. One picture is from Mongolia. Maybe you haven't been to Mongolia yet. I have been there. I implemented a project for nurses in rural areas, as well as the other picture is from Brazil. And we also implemented a project in Brazil. Now, maybe you can imagine, Mongolia is a big country, but with only about 3.5 million inhabitants. More than half of the inhabitants live in the city. The other half lives in the country, in the rural area. And the rural area looks like what you see. This kind of yurts or tents, this is where people live. They don't have healthcare, good healthcare in that area. They have smaller medical centers around, but very small. Very often there is only one nurse there and no doctor. Similar or completely different, if you want, it's in Brazil. Brazil is also, it's a big country, but you have a lot of trees. You have the Amazon, you have a jungle, but there also you don't have doctors, many doctors, you don't have hospitals. So the nurses are the main caregivers in those areas. And now we come to a point which is also important, are the sustainable development goals. Here I want to point out SDG 3, it's good health and well-being. It's SDG 4, quality education, and SDG 5, gender equality. Can you imagine in countries like Mongolia or Brazil in the rural area, how to combine all these SDGs? It is important that you are connected, and you only can be connected when you use digital tools, when you use platforms, software platforms, where you can connect. Okay, next slide, please. Now, you see another picture. This is Iowa. Iowa is not in a low and middle income country. Iowa is a state in the United States. But below, you see a picture of Iowa from the countryside. And I've been to Iowa, and I saw Iowa is a really wonderful place, but it's rural. And when we talk about the United States, very often we think about New York, Chicago, San Francisco, and so on. No, you also have, United States are a big country, and there you have also rural areas. And also in an area like in Iowa, it is important to connect nurses and doctors and patients. And therefore, you need a digital health, software, hardware. Now, what are the challenges when you are in rural areas? You have long travel distances between patients and nurses and hospitals. What you can use as a digital solution would be a video conference, which allows secure video consultations. And not only with patient and remote doctors, but also with nurses. And here I want to talk about or mention an experience I had in Brazil many years ago. And I can tell you, Brazil is very advanced when it comes to digital health, to public health in remote areas. There I saw nurses who had a mobile phone, a smartphone, and that nurse was connected with a patient. She was connected to a doctor, and they had excellent exchange with patients who live far away from the next hospital. So this is possible. This was already done years ago, and this can be done in certain areas where it's not done yet. And especially it's limited access to medical specialists. Imagine, so what we did in Mongolia, we implemented a telepathology project. And it was about doctors who were physicians, general practitioners, patients who had cancer, because telepathology you always need when you have a patient who has cancer. And there were experts in the capital city who were cancer or pathology experts, oncologists, and they were connected even to doctors from the United States, to experts, and from Germany. And they all figured out how critical is the health of a cancer patient. And that is possible when you have certain platforms, digital platforms. So, and next is not only to see a patient, because very often people think, oh, telemedicine, that is when a doctor sees a patient. No, that's not all. So it's also about, for example, paper-based documentation. It's very hard when you have in a hospital or a nurse writes everything on paper. Nobody else can see what she writes. So it's important to have a collaborative online electronic health record, an EHR, which offers structures and digital case files about the patient. So no matter where the nurse is, where the patient is, where the expert physicians are, everybody has access to these EHRs and can see what is important for and about the patient. Okay, please, next slide. Okay, now we have the densely populated urban areas, which is completely different to the rural areas. But nevertheless, you have a big problem there. And as I told you, I'm also working in Africa, and the left picture is from Ethiopia. It is from a rural area, but still it's a city. So here you have twice the problems. In a rural area, you don't have expert doctors, but many patients. And so you have to connect them, the doctors, with expert doctors again. On the right side, you have a picture. It's about, it's one of the biggest favelas, areas in Rio de Janeiro, in Brazil. And there you have many, really many patients, the population is high, the number of patients is high, the number of nurses is not so high, and the number of doctors is really low. So you have to find solutions for these patients, for the healthcare. And I remember it was in Rio de Janeiro also. I realized that in Mongolia, when there was a measles outbreak, where when you don't know who exactly has measles, you cannot do much. But what they did it was in both cities. It was in Ulaanbaatar in Mongolia. It was in Rio de Janeiro in Brazil. Nurses used a mobile phone, and they had it's kind of a form on their mobile phone, and they went from house to house and asked people, how many people live in here? How many people have, or does anybody have measles? How many have measles? How old are the patients in the house who have measles? And they just said, click, click, click on their mobile phone. They went to the next house and did the same for weeks. And then they created a map with all those data, and they found out where are the clusters of measles. And they could, they sent doctors to those houses where there were measles to find out, are there other diseases as well? They vaccinated people. They isolated really certain areas completely for, let's say, 1-2 weeks, so that they didn't leave the area, and they avoided that other areas got infected as well. And this was only possible with digital health, with those smartphones, with an app on it, and they could collect data, and then they even shared this information, the data, with the ministries of health, and it was so valuable for epidemiology, because all of a sudden they had an overview what happened in an area like you see in Rio de Janeiro in that favela. Okay, next slide, please. Now, let's go through the challenges again in densely populated urban areas. So you have an overwhelming patient volume. And again here, an electronic health record, as I explained it, for the measles, but it's not only for measles, but it can help you to collect data, to use data. You can think about other diseases as well. It can be diabetes. It's very important to understand where are diabetes problems, or where are problems of cancer, where are problems of, let's say, especially for women, also for pregnant women. Nurses can visit pregnant women at home and collect data and find out where could there be a problem in pregnancy. Where do pregnant women need more support by, let's say, by a midwife, by a gynecologist? This is much easier when you have an overview, okay? So, and that means you understand immediately where there are not only health problems, but also social problems. And when you look at the picture on the lower picture of this slide, this is a picture I took from a lady who lives in Ethiopia in very, very poor conditions. And there, you have to see that. You have to collect data from such an environment to show to the next social worker where the problem is. Yeah, and again, you can have a video conference platform, which is sometimes important, not always, but you have to collect data, and you have to talk or let's say implement the data and all the information in an electronic health record. That is important. And this is even, when on the first picture, you see that was also in Ethiopia, how many patients you have in a rural area. This is not an urban area. How many patients you have, and you have to organize the system. Otherwise, people will not be treated well. When I saw only a few doctors and so many patients, I understood that it's not only providing digital health, but it's providing training to them, and it's providing help to nurses, because nurses are so important in such an environment. Doctors cannot do everything, and doctors should not do everything, treat every patient, because some diseases can be handled by nurses. Okay, next please. Yeah, so let's say the shared needs. What is needed? And we can say efficient and secure communication. Why do I say secure communication? Because it is important for every country, no matter where, to have secure communication. I'm from Germany. I'm from Europe. We talked about general data protection regulation, but this is also important to countries outside of Europe. It's important to Asian countries. It's important to African countries. No country wants that data, and we collect data in that case, because when we have forms, we have to, we collect these data, and I'm sure, as we don't want that in Germany, we don't want that data from our patients are stored somewhere on a server in China or in the United States or I don't know where. We want to share data of our patients in a secure way. And that is what every country in the world wants. And therefore, I say also in, let's say, in Africa, in Asia, data have to be stored in a secure way. Video conferences shouldn't be stored or recorded somewhere in another country where your country doesn't have control over. That is important, yeah? So therefore, secure communication. But it's also mobile and structured documentation. When once I was in, it was in a Mongolian hospital, and I asked, do you have documents which you fill, so kind of health record, patient record? And they said, yeah, we have it on paper. And I said, okay, can I see one of these templates just to see what kind of data you collect? And then they started searching for a document to show me that, which means they don't really collect data, even not on paper. But the best would be you have an electronic health record on your smartphone and you can collect data easily and share it with others. So this is very, very important. And this would make healthcare and public health much more efficient when you have data and you can analyze data. Again, epidemiology would benefit from such digital data very much. Okay, next slide, please. I would like to go through some use cases now. So, what about a rural primary care clinic? And that is very often primary health care. We're not talking about the clinic where surgery is done, but a clinic where even in primary care clinics, normally you don't do surgery there. Maybe very minor surgeries, but some primary healthcare clinics do have beds, others don't have beds. Yeah, but what you can do in a rural primary care clinic, you can have a few nurses, depends on how big the primary care clinic is. I've seen, again, in Brazil, very efficient primary care clinics, which had no beds, but which had several different departments. They had for first triage to find out when a patient comes, what is the problem of the patient. This was done by a nurse. She talked to the patient. Then she already could say, oh, this patient has this and that problem. So they had different doctors. They even had dentists. They had a gynecologist. They had a practitioner. They had a pediatrician. So this was, but without beds, and they all used digital health. They were connected to each other, and they were connected to the nurses. The nurses from the primary care clinic, they went to visit patients at home, and all the information they collected from visiting the patients at home was collected in the electronic health records, which was again shared with the primary care clinic, and all the doctors had access to this electronic health record. And when the patient came from home to visit the primary care clinic, they immediately could have all the information about the patient, which they collected the first time when a patient was in the primary care clinic, then which were connected when the nurse visited the patient at home, and when the patient came for a second visit to the primary care clinic, all the information was already there. I can tell you, this is sometimes what we dream of in Germany. So don't think we have everything that in Germany, we don't have it. We still built on it, and we are struggling with it. So, but I saw that in Brazil, and that existed. And I saw that partly also in Mongolia, and I was in Sub-Saharan Africa. I was in Rwanda. In Rwanda, they had very good results already with such a primary care clinic. I saw it in Ivory Coast. They were just discussing about how to do it. I saw it in Northern Africa, in Morocco. Morocco has, in some areas, quite good results already. They still have to improve a lot. But you see, we are all struggling. We are all trying to do it. But I just want to tell you what is possible and how easy it could be. Yeah. Okay, next slide, please. Okay. Yes, we already talked about digital solution applications. So it's mainly the nurse. She has all the possibilities to connect to the electronic health record. She knows, and it's always important that all the apps and platforms are easy to use. Okay, so because of course the training is needed, but it should not be complicated. Because when I talk to doctors, I tell them we developed, that is now my company, we developed apps and software, and in a way that it can be easily used by nurses and doctors. Why? Because a nurse and a doctor are not software specialists. They are specialists in healthcare, and what they need is an easy to understand app. Very easy, and that can be done. So, and it's about, when you can use an let's say ultrasound, when you use ECG, when you use radiology images, you want to concentrate on the pictures, because pictures can be shared as well, of course. Yeah. So you want to concentrate on that, on diagnosis, and not on how to use the software. That is important, and that is what we are doing. And by the way, we even have teleconsultations with built-in translation functions. That means when a doctor speaks in one language and the patient doesn't understand that language, it is automatically translated through the app on your mobile phone into different languages, which makes also a lot of sense, because sometimes it depends in which country you are. Patients and doctors are talking in or speaking in different languages. So this has to be easy. Okay, next page, please. Okay, sorry. I just wanted to explain why it is important also for digital forms, not only for nurses or for diagnosis, but you can have, that is important for regulation, for legal regulations. You need, for example, a signature from a patient that he or she agrees on using digital health. That is important. You can do that with digital forms, and you also can use forms for education, for example, for patients who do diabetes self-care checklists, and then patients can fill them out and share them with the nurse. That means the nurse doesn't have to visit the patient every week, especially for diabetes patients or others. So they can communicate in a digital way, and still the nurse and the doctor are aware of the health condition of the patient. So what does it mean? The impact is nurses spend less time on repetitive paperwork. Patients receive faster access to specialist opinion without traveling, and clinical workflows are streamlined and more compliant with data security standards. By the way, specialists without traveling. I'm in contact, and we we are in connection with patients in Saudi Arabia. Patients who are in a very rural area, they have tooth problem, yeah, and they are connected through video conference, through, again, forms. They fill out forms, and they can contact dentists, and dentists will then decide where they have to go, or whether they have to see a doctor, a dentist, and to see which dentist, and they contact nurses and say, okay, maybe the nurse can do something for the patient to relieve pain, for example, and then the nurse goes there. So this is also, one solution. Another project we are just starting is in Egypt. It is about improving healthcare of women in rural areas in Egypt. There we also, now I think I don't even have to explain to you what we can do for these women and also for their children. Okay, next slide, please. Okay, now use case number 2, just briefly, it's mobile community nursing team. There can be nursing teams who connect with each other, and for elderly and chronically ill patients. And this can be in semi-urban and also in rural areas. I will not repeat what I already told you. It's about video conferencing, it's about forums and electronic health record. But I want to tell you why is it important, and that it's not only in low and middle income countries. We have that problem in, for example, in Germany. There are elderly people, and that is maybe special in Germany, because here elderly people live alone at home. They do not always live with their families. This is not because we don't love our older people. This is because older people want that. This would be now an extra presentation about cultural differences in different countries. I will not do that. But we have this problem, and they live at home, and they have diabetes. And very often they are obese, they have high blood pressure, and they do not move a lot. They lay in the bed the whole day. And when you lay in the bed the whole day, and that for weeks, you have problems with your skin, and your skin gets you have the surface of the skin is infected. And when you have diabetes, and for example, legs, patients don't feel the pain, and the problem gets bigger and bigger. And here we have this, as a solution, there are nurses visiting the patient. They take pictures of the leg, of the wound, and share it with a wound manager or a physician. And then the physician tells the nurse how to treat these wounds, or whether the patient has to be delivered to a hospital. So this improves a lot the condition of a patient, because otherwise, and this is a problem we have in Germany, we have, when you don't realize it early enough, there will be amputation of the leg. And this is what we don't want to have in our healthcare system, and we don't especially not have that for the patient. This is so much pain for the patient, and it reduces his quality of life. Okay, and now next slide. This is just a short remark that can be tablet-based. We can do it with a smartphone. There can be remote collaborations with different doctors and wound managers, with people who are specialists in wound infections. So this is only an example. I could give you many more examples, as you can imagine, as I have seen in my projects all over the world. Okay, now, next slide. Next slide. So, thank you very much. No, next slide, yeah. I hope this was of some kind of interest for you, and if you have any questions, you're welcome to contact me, and we can talk about projects. If you have questions, if you are interested in, or if you have questions because you are in a project already, you're welcome to contact me. Thank you very much.
Great, that's really excellent, Anna. So it's like great. I was really spellbound to listen to your speech. It's very interesting to me, and I felt like there are a lot of practicalities involved in it. And your presentation was awesome. Thank you so much for an excellent presentation. What you have done, that's really great. And definitely, if we need any people have any questions on this, definitely they're going to come back to you with the mail ID which you have provided. That's excellent, excellent. Thanks a lot for your time, and a huge round of applause for the speech.
Thank you.
Yeah. Thanks a lot.
Thank you for allowing me to talk here. Thank you.
Thank you. Great.